with all that healthcare background, I am technology or PowerPoint challenged, so hopefully the words will be readable. It looks like it's a pleasure to be here today, and it's my pleasure to be able to introduce the efforts of the Council of Children's Hospitals, which is 12 very strong organizations that have been committed to the care of children in New Jersey for many, many, many years. They have worked diligently over the last 20 months to come together, putting aside historical competitive issues and really addressing, looking from a policy perspective, from an infrastructure perspective, from a workforce perspective, what can we do to strengthen the network of services across the state and ultimately enhance the care of our children throughout the state. Yeah, I am pressing enter. Okay. Did you go up or down? Okay. Apologize again. Again, we came together 20 months ago, so we are relatively young. We feel that we are growing up exponentially, and we believe we have a story to tell and hopefully inform all of you of the resources you do have and areas of opportunity for us to build in the future. When we came together, our goal was to create a more effective healthcare system. And you really have to look at yourself and understand what you are and what you aren't. And we are very fortunate to be kind of sandwiched in a state that has very strong pediatric resources, both in New York and in Pennsylvania. And we have grown and are stronger because of that. We also know that we provide some very unique opportunities and resources because we are community or regionally based. We can provide that family-centered environment. We can be a part of a larger health system that takes care of all members of the family. And ultimately, because we are in the regions, in the communities, in the counties, we can partner with many of you as you relate to children through other agencies, through federally qualified health centers, through working in that educational mode, preventive care mode. And ultimately, our goal is to provide that comprehensive medical home for children and ultimately the family members that they are a part of. I want to quickly introduce you to the 12 members at the table. We have 9 acute comprehensive children's hospitals, 2 rehabilitative hospitals, and we also have UMDMJ, who is our medical school and has the Children's Institute. So I'll quickly read through them because you probably won't recognize all the logos. Goriab Children's Hospital and Atlantic Health System up in Morristown, Bristol-Myers Squibb Hospital at Robert Wood Johnson University Hospital, K. Habnanian Children's Hospital in the Meridian Health System, St. Joe's Children's Hospital, the Children's Hospital at Cooper University Hospital, the Children's Hospital and Regional Perinatal Center at Monmouth Medical Center, Joseph Sanzari Hospital, Children's Hospital at Hackensack, our Children's Hospital of New Jersey at Newark Beth Israel Medical Center, Children's Hospital at St. Peter's University Medical Center, Children's Specialized, which is a rehabilitation institution, Weissman's Children's Rehabilitation Hospital, and the University Institute for Children's Health at UMDMJ within the university hospital system. As an integrated network, we provide 234 level 1 NICU bassinets. We provide 154 intermediate bassinets. We provide 95 PICU beds, 16 cardiac ICU beds, 99 pediatric emergency department beds, and 80 rehabilitation beds, 63 skilled nursing beds. So we have a wide array of services available for our children. In 2007, we cared for over 200,000 children through our pediatric emergency departments in the visits to our emergency departments. We had over 45,000 inpatient stays caring for our children within those institutions, and we had over 1 million outpatient visits, again, looking at that preventive care, follow-up care, chronic care. We're very proud to show you the strength of what we are providing. Whoops. This just gives you a sense of the demographics or where we are located throughout the state, and ultimately we provide via our medical staff over 750 full-time pediatric subspecialists, hundreds of part-time subspecialists, and obviously thousands and thousands of nurses and allied health professionals. So you have quite a team that is serving you the children. We have spent a fair amount of time in that 20 months really trying to focus and come up with a unified mission and vision. And we are passionate about working through health policy issues, through improving workforce, through improving clinical care to make sure that the New Jersey children, their families, and the communities in our that surround our institutions are getting the best care possible. Our goal is to provide that comprehensive medical home for the children and ultimately give us the ability to treat the whole family through our sponsoring or affiliated adult institutions. Dan was commenting about our work on the physician workforce. We are presently doing a comprehensive physician workforce analysis for adult and pediatric for the entire state. It is very challenging to try to mesh AMA databases, New Jersey Board of Medical Examiners databases, and really understand exactly who is practicing in New Jersey and the extent of their practice. They can be registered or licensed as an OBGYN, but it's almost impossible to figure out if they're still doing deliveries. So we're really trying to work through all that to understand exactly who's giving care for what child or for an adult. We have a reasonable number, if you look at national ratios, of pediatricians throughout New Jersey, and they are actually reasonably distributed throughout the state, and I'll show you a map in just a minute. We do have, as 49 other states do, have challenges with pediatric subspecialists in some of the areas throughout the state, and we are addressing those aggressively, and I will talk about that and get into that in just a minute. The question that Dan asked me, and I think our 12 institutions have asked ourselves as we've gone through elaborate strategic planning, is are we ready for the job? As we expand family care, as we hopefully get more and more children not only insured, but reasonable access, transportation, et cetera, do we have the resources to care for those children? And we believe we do. We absolutely feel that we are prepared for that. We have plans, as I said, where there's opportunities to grow. And we do have the ability, when there are certain quaternary services that we do not have, to refer, as I already said, to New York and to Pennsylvania. We have come together with a unified mission and voice, which is a huge hurdle to overcome. We have totally inventoried the depth and breadth of our clinical services and our subspecialties. And we are building a website so that is readily available for both providers as well as family members, so that you know what institution has what level of service and what pediatric subspecialists are available at what institution. We have, again, not only inventoried existing outpatient and community services, but we've already started an education process to cross-fertilize. Some of our institutions, such as St. Joe's in Patterson, has a tremendous obesity prevention program. And now we are using their model and getting that into communities throughout New Jersey. We are sponsoring obesity summits. We are really trying through both quality and patient safety initiatives to make sure every institution can benefit from the best practices of another institution. And that will allow us to rapidly deploy those programs throughout our communities. We've created a strong infrastructure for care. We've created a referral process between our own institutions and ultimately hope to go out and educate other hospitals. We've met with the various insurance companies. We've met with Medicaid. Again, it's an education process to really understand who we are. We have advanced technology and, most importantly, a very comforting and environment where you can get to readily throughout the state. As I said, we're continually improving. One of the things we absolutely have in our mission is that we have to provide and show you the quality care that we provide. We cannot just say we provide good care. We have to demonstrate it. We have to give you scorecards. We have to be willing to show you our outcomes. And we have been in the process of putting that balanced scorecard together. We just came back from Salt Lake, where we were working in a subgroup on the national scorecard and trying to get that moving forward through some of our agencies and such. And we are ready for comparison. Our institutions are involved in over 75 either local, state, or national projects where we benchmark ourselves constantly, and we are very pleased with how we look compared to national norms. One of the things that we believe is the key to access, true access, is we've got to improve our physician reimbursement, our pediatric reimbursement. As many of you know, because you're in this environment, we are like 43rd, 47th. We move around a little bit, but at right above Mississippi as far as what we pay our pediatricians. I had a conversation with the executive director of the California Association, and they are right below Mississippi, so I guess we felt that we were very close in our commiserating. But generally, the reality is, and I've heard people from a health policy perspective, they know that Children's Hospital and pediatricians have hearts as big as gold, and they perceive that even if their reimbursement is low, they would never turn away a child. And the reality is there's some truth in that, but we also have many children that wait a fair amount of time, even though we have a reasonable number of certain specialties, because that particular group of specialists don't take the insurance that that child has. We've got to change this, and we're working diligently from a health policy to do that as a unified voice. We've got to improve the pipeline of future physicians, and again, I'm going to talk about that. Our current shortages are pretty consistent with what other states are facing. We have a couple areas like the developmental behavioral area. Because we have such a high rate of autism in the north, even though our ratios show we have a lot of those specialists compared to a national norm. The fact is we still don't have enough because it takes way too long for our children to get in and be evaluated. But we are, again, working now across organizations to see, as we recruit, how we can recruit and retain physicians and not just look at it from a single institution perspective. This is a map I was talking to you about before. It's a little hard to read, but as you can see from a general pediatrics perspective, the two yellows mean that we actually have surpluses compared to what the federal government says your ratio should be. The gray is that there's less than 10 physicians, 0 to 10 as far as a deficit, and then the white is 10 or greater as far as a deficit. The good news is that in the two counties where we have greater than 10 deficit, in the counties either to the north or to the south, in the case of Warren, there is a lot of additional pediatric physicians available. And they tend to, the hospitals tend to be in those adjacent counties. So we really are in fairly good shape. Like I said, one of the things we've been doing is not only looking at the current shortages, which was on the previous slide, but looking at by 2015, I'm sorry, I flew in from the West Coast, 2015, where we need to be. And again, like most of the 49 other states, we have challenges in how are we going to address, recruit, retain, and train the adequate subspecialists that we need. The areas that we are looking at, or some of the programs that we are looking at are already existing in New Jersey, but they don't necessarily address some of these subspecialty areas, so you look to expand those. Loan redemption. I have some creative ideas in other areas, but again, let's just continue on this thought process. If you look at Pennsylvania and New York, as far as ratios of their pediatric subspecialty fellowship positions. Now, these are physicians in training. You can see the ratios are pretty equal per the 100,000 population in Pennsylvania and New York, and our ratio is very, very small. We only have 55 fellowship positions in pediatrics. There is a reason for that, and that partly is because our medical school is relatively young as you compare a medical school to many other medical schools across the nation. And at the point where this type of growth pattern, where they'd be looking at this type of subspecialty would have occurred, is when the Balanced Budget Act came in and froze all funding for new fellowship positions or new resident positions. So we've been challenged both currently and trying as a state to look at this and how do we address it. Some of the things that we are looking at is as a institution closes, like Muhlenberg has just closed. They had a number of resident slots. We are putting in a waiver to CMS that as a state, we can retain those slots and then, based on our physician workforce need, allocate those slots appropriately so we can address future needs. So those are some of the creative health policy related items that we as a team have been working on. Now, one of the premises of this particular conference was to address the Commonwealth report. And we, as I'm sure everyone in this room are very concerned about our low score. And ultimately, as you look at those 13 indicators, I am hoping from this conference that each of us take 2 or 3, that we take the leadership position on, we participate in the other 11, 10 in brainstorming and team working of how we make a difference. But we are prepared as the council to come to the table, work with the state, work with all of you, to address specialty care and access and some of the other areas like creating medical homes, so that we can make significant improvements in this report. And as you know, we, and Mary referenced, we are challenged at this time, as every other state, to deal with the national and then ultimately the state fiscal instability. But we have got to continue to have that unified voice and make sure there's no child left behind in this process. And ultimately, I absolutely agree with everything Mary said. I worked on the task force that put the legislation together, and you've got to be able to market. You've got to be able to get the word out. You've got to have a recruiting strategy to get those children insured. But more importantly to us is that we've got to deal with the physician reimbursement, and we've got to deal with true access and getting them their preventative care and their medical home. I said that we were quickly going to talk about other areas. We realized that, quite frankly, that from the previous statistic, that Pennsylvania and New York have a wealth of positions. And I know that they're challenged as well with some of the shortages. But I think some of the areas that we should consider is, because we have graduating physicians right across the rivers from us, what can we do to educate them of what we have as far as the infrastructure, and hopefully look very appealing to them as a practice environment. That then means that we also have to address that practice environment. We have to address medical malpractice and some of those other barriers that keep physicians from considering the Northeast and moving more into the center of the nation. Because of that 55 slots that we have been doing post-graduate resident exit surveys. And currently, your resident that has just graduated as a pediatrician, 68% of them are seeking and going for subspecialty training. Of that 68%, approximately 23% are fairly committed to coming back to New Jersey. There's another whole, there's obviously subcategories about them going to other states or to other countries because of their immigrant status. But there's another 40% of our graduates that are seeking that additional training that are undecided. Well, to me, that 40% is this wealth of opportunity to influence them now through some reimbursement programs and such. So we have a lot of opportunity, and again, as a group, we're looking at many ways. We have a highly competitive environment, both internally and within the state and across states, and we can't let that deflect on our proposed objectives. We also have to correct misinformation regarding our health resources and capabilities. I guess maybe we're the greatest kept secret. As we have met, again, with state agencies and with insurance companies, and we've asked them to come and tour our facilities, every time they do follow through with that, they are astounded with the capabilities and resources we have. So we need to get that word out, and we want everyone across the state to know that they have some excellent resources to tap into. New Jersey has a lot of political will to address children's issues, and we need to harness that, and we need to grow it, and we need to keep it, again, very focused. And we as an organization, as well as working with other associations that have interest in children's health, need to jointly work on that together. We need to commit to that training responsibility and come up with creative programs. We need to better utilize our resources within UMDMJ, which does have a vast amount of resources, and Dr. Owens is very committed to children's health. We need to recruit subspecialties from New York and Pennsylvania. We need to expand our loan redemption program for key specialists where we're going to have the greatest shortages by 2015. And this is just a little education. This was part of the AAP district survey. And basically for there was a total of, in this particular survey, of 54 residents that responded. And of that group, you can see the substantial amount of debt that they have and are trying to work through. Of the percentage of, I said 68% were going on to subspecialty training. Of the percentage staying as a general pediatric physician, 40% of them said the reason they're staying is they can't afford it. They just have to stay and pay off their debt. They cannot afford to go on. So those are all issues that we all have to realize we're grappling with. I think we've talked about these. The third bullet was improving access, quality, and equity indicators as outlined in the Commonwealth report. Again, I'm hoping we will all divide and conquer and work on that in unison. We are inviting you. This is your call to action. We want you to come to our institutions. In fact, on the desk out, your registration desk, we have contact numbers. We'd like for you to look at what institution is closest to you, where you either work or where you reside. We'd welcome you to call these individuals up and tour, or call and just ask questions, because we really believe that you will be very pleased with what we have as far as resources. We also, I have a map of the state and our institutions, and we list all the pediatric subspecialists that are at those institutions so that you can get a sense of the depth and breadth of those physician resources. We hope you'll become a convert and spread the word. And I hope you will partner with us to strengthen what we consider a very valuable asset of the state. And how can you do that? How can you partner with us? By being here and being an ongoing champion for children's health, for helping us provide the best comprehensive care locally, and ultimately, and we believe that there is a volume of children growing across the river for tertiary and quaternary services that we can easily care for. And by sending those children across the river, you actually erode the infrastructure of your children's health system within New Jersey. And we believe that if you understand who we are, what we have, and we can keep the right children within the state, then we can actually strengthen ourselves. And that's all part of our jobs. Thank you.